Welcome to the deep dive.
Great to be here.
Today we're tackling a topic that quite a few of you have asked about, nasal fibrosarcoma in dogs and cats.
That's right. FSA, as it's often called.
Exactly. We've gone through the medical literature, the studies, to really, pull out the key info on this specific tumor.
Yeah, trying to understand what it actually is, how it presents itself, and importantly, what the options are if you're faced with it.
So let's maybe start with the basics. What is nasal fibrosarcoma?
Okay, so nasal fibrosarcoma, or FSA, it's a malignant tumor. That means it's cancer.
Right.
It starts from these cells called spindle-shaped cells. You can sort of picture them elongated.
Okay.
And these cells normally produce collagen, which is like, the scaffolding protein in the body.
Ah, okay.
Now, the key thing here is their shape and origin means they can kind of weave through tissues, making these tumors pretty invasive locally.
Locally invasive. Got it. And how common is it?
Well, for dogs, it's actually quite significant. It's the second most common type of nasal sarcoma we see.
Really? Second most common.
Yeah, accounting for maybe up to 5% of all tumors found in the canine nose and sinuses.
Wow.
But interestingly, it's much, much less common in cats. We don't see it nearly as often in them.
Okay, that's a key difference.
Definitely. The big takeaway is its local aggression. It likes to invade nearby tissue, which makes catching it early really important.
So whether you're listening because maybe you're a pet owner who's noticed something concerning,
Or maybe you're in the veterinary field looking for a quick overview.
right, or just curious about animal health complexities, our aim here is just to give you a clear picture, without drowning you in technical terms.
Exactly. Clear and informative.
So let's start with who gets affected. You mentioned dogs more than cats, but within dogs.
When we look at the data for dogs, there's actually no specific breed that stands out.
Okay.
And no real gender predisposition either, male or female. Doesn't seem to matter much.
What about age?
Age is interesting. The median age, like the middle value for diagnosis, is around 9 years old.
So typically older dogs.
Typically, yes, but, and this is important, it can really happen across a huge age range. We've seen it in dogs as young as 1 year old.
Wow, that young.
Yeah, and up to seniors, like 16 years old. So age isn't a definitive rule,
Okay, good to know. And for cats, you said it's less common?
Much less common. And the info we have doesn't really point to any specific breeds or genders being more at risk in those rare cases either.
Okay. So it seems quite widespread in dogs, potentially. What are the signs then? What might someone first notice, those early clues?
Often the very first things are, well, they can be quite subtle.
Like what?
Like nosebleeds, what we call epistaxis.
Okay.
It might be just from one nostril or sometimes both. And maybe you'd see some nasal discharge too.
What kind of discharge?
It can look kind of thick, maybe mucousy with some pus mixed in. We call that mucopurulent discharge.
Mucopurulent, right. Got it.
Huh.
So nosebleeds, discharge, what else?
You might also notice more sneezing than usual. And their breathing might sound noisy, kind of like a snore or a snort when they're just breathing normally.
Oh, that's called stertorous breathing, isn't it?
Exactly, stertorous breathing. And sometimes you might actually see a change, like swelling on their face or the shape looking a bit different. Facial deformity, we call it.
Facial deformity. Okay. And I guess these signs can worsen.
Unfortunately, yes. As the tumor grows, things can progress.
Yeah.
You might see they're not eating as much, their appetite decreases,
Right.
and maybe bad breath halitosis. That can be a sign it's starting to push into the mouth area.
Into the mouth, okay.
And then there's the more serious progression. If the tumor manages to invade upwards towards the brain,
Oh, wow.
yeah, that can lead to neurological signs, things like seizures or changes in their behavior, acting differently, or just seeming really dull and out of it. Obtundation is the term for that reduced alertness.
Obtundation. That sounds quite serious. The thought of it reaching the brain is pretty sobering.
It is. It highlights how invasive it can be.
So what might a vet pick up on during an exam that points towards FSA?
Well, the physical exam often backs up what the owner's been seeing.
Okay.
So again, the vet's looking for those nosebleeds, the discharge, checking if it's one side or both. They might test the airflow through each nostril. Often it's reduced on the affected side.
Makes sense.
Gently feeling around the nose and sinuses might reveal pain. And they'll look closely for any facial asymmetry, any bulging of one eye, that's exophthalmia.
Exophthalmia, right?
Or difficulty pushing the eyeball back gently, and maybe excessive tearing from that eye, which is epiphora.
Okay.
And sometimes, they might even see a mass if they look inside the mouth.
So a whole constellation of signs, really. Some quite subtle at first.
Exactly.
Now, if a vet suspects this, it sounds like there are other things it could be, right? What else needs to be ruled out? It feels like being a detective.
It really is. Diagnosing nasal FSA isn't always straightforward because, several other conditions can look very similar. It's a process of elimination.
So what's on that list?
First, you have to think about other kinds of nasal tumors.
Okay.
Things like adenocarcinoma, that's actually the most common nasal tumor in dogs, squamous cell carcinoma, chondrosarcoma, which arises from cartilage, osteosarcoma from bone, even lymphoma.
Okay, quite a few tumor types.
Yeah, and in dogs, there's also something called a transmissible venereal tumor that can, rarely, show up in the nose. For cats, nasal polyps are a big one to rule out. They're benign growths, but cause similar signs.
Polyps, right. Okay, that's already a lot. Anything else? Non-tumors.
Oh, yeah. Infections are high on the list, especially fungal infections.
There you go.
Yep, like aspergillosis or penicilliosis, particularly in dogs. Cryptococcosis in cats is a big one. Sporotrichosis can affect both, even rhinosporidiosis in dogs.
Wow.
Then you have viral infections, maybe herpes virus or calicivirus in cats causing chronic rhinitis.
Okay.
And you can't forget simpler things like just a foreign object stuck up there, a grass seed or something.
Happens all the time.
It does. Or problems with blood clotting, maybe low platelets, thrombocytopenia, or other coagulopathies causing the nosebleeds.
Right. Got to check the clotting.
And finally, dental disease. A bad tooth root abscess can sometimes erode into the nasal cavity, or an oronasal fistula, which is an abnormal opening between the mouth and nose.
Goodness. It really is like searching for a needle in a haystack sometimes.
It highlights why diagnostics are so key.
So what are the first tests a vet usually runs?
Well, interestingly, the standard blood tests, like a CBC and chemistry panel, and even a urine analysis, they're usually normal with nasal FSA.
So that doesn't help much directly.
Right. It's good for ruling out other systemic diseases, but it doesn't point to FSA. It can be a bit frustrating, actually.
I bet. What about looking at cells from the nose?
Nasal flushes or swabs to collect cells for cytology, looking at them under a microscope or for culture. They're often not very rewarding for diagnosing FSA itself. The tumor cells don't always shed easily. But, as we mentioned, blood clotting tests might be run just to make sure that's not the cause of any bleeding.
Okay. So if blood tests are normal and flushing isn't great, imaging must be critical then.
Absolutely essential. Imaging is where we really start to see what's going on.
X-rays first.
Standard skull x-rays can give some clues. You might see increased soft tissue density in the nasal cavity or sinuses, maybe some evidence of bone destruction.
Good.
But honestly, a CT scan is much, much better. Night and day, really.
How so?
CT gives incredible detail. It shows the exact extent of the soft tissue mass, how much bone has been affected or destroyed, and crucially, it shows if the tumor is pushing towards or into the brain. That's vital information for planning treatment and understanding the prognosis.
So CT is really the gold standard for seeing the extent.
Definitely. And we also always do chest x-rays.
To check for spread.
Exactly. To look for any signs of metastasis to the lungs, even though it's not super common initially with FSA.
Okay, so imaging maps it out. But how do you get that 100% confirmed diagnosis?
The only way to be absolutely sure it's nasal FSA is with a tissue biopsy.
Taking a piece of the tumor.
Precisely.
Yeah.
Taking a small sample of the abnormal tissue, sending it to a lab for histopathology.
Histopathology.
Yeah, where a pathologist looks at it under a microscope, identifies those characteristic spindle cells, and confirms the diagnosis.
That sounds crucial. Any risks with the biopsy itself?
Yes, technique is really important here. You have to be very careful, especially with where you're taking the sample from.
Why is that?
Because there's a delicate, thin bone at the back of the nasal cavity called the cribriform plate. It separates the nose from the brain.
Okay.
If the biopsy instrument accidentally goes through that plate, well, that can cause serious complications, potentially damaging the brain. So it needs to be done carefully, often guided by imaging like CT.
Okay, so a very precise procedure. So let's say the biopsy confirms FSA. What happens next? What are the treatment options?
Okay, so once you have that confirmation, the main treatment, the preferred approach for nasal FSA, is radiation therapy. Yes. Traditionally, this has been done using what's called conventional linear accelerator radiation. Multiple treatments over several weeks.
Okay.
But Becoming more common now and often preferred, if available, is stereotactic radiation therapy, or SRT.
Stereotactic, what's the difference?
SRT uses advanced imaging guidance to deliver very high doses of radiation with extreme precision right to the tumor, while minimizing the dose to surrounding healthy tissues.
Ah, so more targeted.
Much more targeted. This often means it can be done in fewer treatment sessions, maybe just 1 to 5 instead of 15 or 20.
Wow, that's a big difference.
It is,
Yeah.
and potentially fewer acute side effects, though it's still a powerful treatment.
That sounds like a significant advancement.
It really is. Now, for cases that are very advanced, or maybe the pet has other health issues, a full course might not be suitable. In those situations, palliative radiation might be an option.
Palliative,
Yeah.
meaning just for comfort.
Essentially, yes. It uses lower doses and fewer treatments, aiming to shrink the tumor enough to relieve symptoms like congestion or bleeding and improve quality of life, but it's not usually curative.
Okay. What about surgery? You hear about surgically removing tumors all the time?
That's a really important point. For nasal fibrosarcoma, surgery alone is generally not considered an effective treatment.
Why not?
Because, as we said, these tumors are so locally invasive, they send out microscopic extensions like tiny roots into the surrounding tissues, bone, everything. It's almost impossible for a surgeon to remove all of those microscopic bits.
So even if they remove the main lump, tiny bits get left behind.
Exactly. And those bits will almost inevitably grow back, often quite quickly. So surgery by itself usually leads to recurrence. It might sometimes be used in combination with radiation, but rarely on its own for FSA.
Okay, that's crucial to understand. Radiation is key. Are there other medications that help alongside that,
Yes, definitely supportive medications can play a role in managing symptoms.
such as?
Well, for instance, prednisone, which is a steroid, can sometimes help shrink inflammation and reduce nasal congestion, making breathing easier.
Okay, steroids.
And for those troublesome nosebleeds, sometimes a vasoconstrictor nasal spray, like one containing phenylephrine, can be used carefully and sparingly to help stop acute bleeding.
Phenylephrine, okay.
And if the vet suspects a secondary bacterial infection has set in, which can happen with all that inflammation and tissue damage, then antibiotics would be prescribed.
Makes sense.
But honestly, the most important thing here is working closely with a veterinary oncologist. They specialize in cancer treatment and will have the most up-to-date knowledge on the best protocols, drug combinations, radiation techniques.
Right. Specialist input is vital.
Absolutely critical for tailoring the best plan for the individual pet.
And once treatment starts, what kind of follow-up is needed?
Monitoring is key, so regular physical exams are important, maybe every couple of months initially.
Checking for recurrence.
Exactly. Checking for any return of symptoms, assessing their general health, and periodic chest x-rays, usually every 3 to 4 months, are standard practice to keep monitoring for any potential spread to the lungs.
Okay. Do they ever repeat the CT scan?
Sometimes, yes. If symptoms return or worsen, or maybe after finishing radiation, the oncologist might recommend a follow-up CT of the head to get a detailed look at how the tumor responded or if there's evidence of regrowth.
Okay. So that brings us to the big question. What's the outlook? The prognosis.
It's a mixed picture, honestly. The relatively good news first is that nasal FSA doesn't tend to spread widely through the body, at least not early on. The overall metastasis rate is generally less than 20% at the time of diagnosis.
Less than 20% spread initially. That's somewhat reassuring.
It is. When it does spread, it most commonly goes to the regional lymph nodes, near the head and neck or to the lungs.
Okay. But what about survival time?
If only palliative care is given so, just managing symptoms without definitive treatment like radiation, the survival times are unfortunately quite short. The median is typically around 3 months.
Only 3 months.
Yeah. But with definitive radiation therapy, the outlook is significantly better.
How much better?
The statistics generally show that with radiation, roughly 50% of dogs, half of them are alive and without local tumor recurrence at the 1-year mark.
Okay, 50% at 1 year.
And about 30% are still doing well at the 2-year mark.
30% at 2 years. So radiation offers meaningful time, but it's still a very serious disease.
Absolutely. It's a significant improvement over palliative care, but it's often not a cure in the long run for many patients.
Are there things that make the prognosis worse?
Yes, there are some known negative prognostic factors. If the CT scan shows the tumor has already spread into the frontal sinuses, those air pockets higher up in the skull, or if there's significant erosion or destruction of the nasal bones, those factors increase the risk of the tumor coming back locally after radiation.
Okay, more extensive disease locally is worse.
Right. And as you probably guess, if the tumor has already invaded the brain at the time of diagnosis, that's a major negative factor for survival time.
Makes sense. Anything else? Does it matter if it's one side or both?
Interestingly, the studies suggest that whether the tumor involves just one side of the nasal cavity or both sides doesn't seem to make a significant difference to the overall prognosis after radiation.
Huh. Okay, that's interesting.
Yeah.
So that's a lot of detail, but really useful. Bringing it back to you, the listener, we hope understanding all this, the signs, the diagnostic steps, the treatments, helps you feel more empowered.
Yeah, knowledge is power, right? If you notice some of these signs in your pet, having this background can help you ask informed questions when you talk to your vet.
Absolutely. And it really underscores that catching things early and getting that proper diagnosis and treatment plan are just so crucial for the best possible outcome.
Couldn't agree more. So just to quickly recap the key
Good
points.
idea.
Nasal fibrosarcoma, FSA, it's a malignant tumor, more common in dogs than cats. Signs often start with things like nosebleeds, maybe some sneezing, discharge, facial changes.
And can progress to appetite loss or even neurological signs if it invades the brain.
Right. Diagnosis involves ruling out a whole bunch of other things and really relies on advanced imaging like CT scans and, crucially, a tissue biopsy for histopathology.
And treatment.
Radiation therapy is the mainstay. Stereotactic radiation is often preferred if available. Surgery alone, not usually effective.
Got it. And while it doesn't spread super commonly initially, the long-term outlook depends a lot on the tumor's extent and response to treatment,
Yeah,
with radiation offering that median survival of, maybe a year or more for many.
exactly.
Okay, so here's a final thought to leave you with. When you hear about treatments like stereotactic radiation, it really makes you think about the incredible progress happening in veterinary oncology, doesn't it?
It really does. The options we have now compared to even 10 or 20 years ago are amazing.
It pushes us to keep learning about these innovations for our pets. So maybe the question for you to ponder is, what other questions does this raise for you about where cancer treatment for animals is heading next?
Great question to think about.